Describes the Abdool Karims as world-leading AIDS researchers whose main interests are in understanding the evolving HIV epidemic in South Africa, including factors influencing acquisition of HIV infection in adolescent girls and sustainable strategies to introduce antiretroviral therapy in resource-constrained settings. The Foundation statement says the duo have saved lives around the globe through their innovative research, evidence-based policy proposals, public education, and courage to speak truth to power. Awards established in 1945 by pioneering biomedical research advocates Mary and Albert Lasker is now regarded as America's preeminent biomedical research prize, which carries an honorarium of $250,000. The couple received the award at a ceremony in New York City last Friday.
We're honored to be joint recipients of the Lasker-Bloomberg Public Service Award, and particularly touched that the citation was read by Peggy Hamburg. I want to use this opportunity to congratulate our fellow awardees. This recognition is humbling, but it's also a powerful reminder of the transformative role of science in shaping a more inclusive and just world.
Served as chair of the South African Ministerial Advisory Committee on COVID-19 until 2021, while they both serve as professors in the Department of Epidemiology at Columbia University's Mailman School of Public Health, and direct the Centre for the AIDS Programme of Research in South Africa, Quarraisha, based at the University of KwaZulu-Natal, among other roles.
Lasker Award, we are recognizing the power of global solidarity, the power of global solidarity to have global impact. And this is the approach that is deeply imbued in our work in HIV prevention and treatment over the past 35 years. When we provided in South Africa the initial evidence that antiretrovirals prevent sexual HIV transmission as PrEP, today, PrEP is used in over 100 countries across the world. If a patient with TB and HIV co-infection anywhere in the world is being treated on World Health Organization or CDC guidelines, they're being treated based on research done by a multi-country collaboration done in South Africa. In a world racked by division, conflict, and war, this award is a sober reminder of how science reminds us of our shared humanity across the globe.
Their lived experience growing up in apartheid South Africa has had a profound impact and effect on how they see their role as scientists, while praising former President Nelson Mandela for having shaped their perspectives on the role of scientists serving society, as both their careers veered towards public health, spending over 30 years focused on the health of the most disadvantaged in their society, young black women in particular.
Some 35 years ago, when the world's attention was on HIV in men who have sex with men, we found that in Africa, young women bore the brunt of the HIV epidemic, largely due to sex with men who were about a decade older. And so we focused our research on developing and testing technologies that empowered women to protect themselves. Our contributions to HIV pre-exposure prophylaxis were one small but important step in the larger social challenge of gender power dynamics that highlights the powerful role that science can play in social transformation. We are indeed in a tumultuous moment globally, a time when science is needed more than ever to tackle several of the world's most complex challenges.
Science as transcending political and cultural barriers, a universal language to build bridges between peoples of the world, while pointing to shared vulnerabilities that underscore the importance of working together as scientists in the service of humanity. Sherwin Bryce, SABC News, New York.